Welcome back to your pediatric dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for detail of this channel visit the bio section, or you can also check out my first video. Today we will discuss one of the most important topics and the base of pediatric dentistry, which is development of occlusion. If you learn and memorize this topic, trust me, pediatric dentistry will become so easy for you. The term occlusion is derived from the Latin word occlusio, defined as the relationship between all the components of masticatory system in normal function, dysfunction, and parafunction. All the components of masticatory system include the teeth, periodontal structures, temporomandibular joints, muscle of mastication, and nervous system. There are stages of occlusal development. So first is predentate jaw relation, which is before the teeth erupt into the oral cavity. Second is the deciduous dentition period, the mixed dentition period, and the permanent dentition period. So starting with the predentate period, this is a period soon after birth. The alveolar process at the time of the birth is called gum pads. They are horseshoe shaped pads that are pink, form, and covered with a layer of dense periosteum. They are divided into two parts by dental groove. The gum pad is further divided into the 10 segments by transverse grooves. Each segment has one developing tooth sac. There is a one developing tooth bud. A very important landmark in the gum pad is lateral sulcus, which is the transverse groove between canine and first molar. This is helpful in predicting interarch relation at a very early stage. How? So the mandibular lateral sulcus is positioned slightly posterior to the maxillary lateral sulcus, which provided an early indication of occlusal alignment. Any deviation in its positioning may indicate potential orthodontic concerns that require monitoring. Lateral sulcus contributes to the separation of the maxillary and mandibular gum pads, allowing the tongue to rest between them. This positioning aids in shucking and early jaw function, which in turn influences the development of dental arches. The maxillary gum pad is wider and longer than the mandibular. Thus, when they are approximated, there is a complete overjet all around. Only contact that is occur around the molar region, while space exists in the anterior region. This is called infantile open bite, which is considered normal and helpful during suckling. Coming to the deciduous dentition period, the initiation of primary teeth occurs during first 6 weeks of intrauterine life, and the first primary tooth erupt at the age of 6 months. The individual variation apart, it takes around 2.5 to 3.5 years for all the primary teeth to establish their occlusion. Coming to the spacing. So Delabre in 1918 was the first to describe the interdental spacing in primary dentition. Baum in 1950 divided the primary dentition into two parts, that is spaced dentition and non-spaced dentition. He also concluded that primary spacing occurs around 70% in maxilla and 63% in mandible. Foster and Hamilton in 1969 reported that only 1% of British children had no space. White and Gardiner 1976 reported that failure of incisor spacing occurs in 20% of the cases before 5 years of age, usually indicated crowding in the permanent dentition. Joshi and Makija in 1984 found out a greater number of primary teeth spacing in males than females. Now coming to this spaced dentition. So it's supposed to be the good as space in between the teeth can be utilized for the adjustment of the permanent successor, which are always larger in size compared to the deciduous teeth. There are two type of space: physiologic space and primate space. So physiologic space present in between all the primary teeth and play an important role in normal development of the permanent dentition. Total space present may vary from 0 to 8 mm with the average of 4 mm in the maxillary arch and 1 to 7 mm with the average of 3 mm in mandibular arch. This is your MCQ question. Primate space exists between the maxillary lateral incisor and canine and mandibular canine and the first decidus molar. These species are also called anthropoid or simian species. This is also your MCQ, as they were initially found in our ancestral simian species. Coming to the non-space dentition, so this dentition is highlighted by lack of space between primary teeth, either due to small jaw or larger teeth. This type of dentition usually indicate to crowding in developing permanent dentition. Coming to the terminal planes, so the mesodistal relationship between the distal surface of the maxillary and mandibular second decidus molar is called terminal plane. This is of three types. First is flush terminal plane. So the distal surface of the decidus second maxillary and mandibular molars are in straight plane, which is flush and therefore situated on the same vertical plane. It is usually most favorable relationship to guide the permanent molar in class 1 relationship. It is seen in 74%. Mesial step terminal plane. So the distal surface of the decidus second mandibular molar is more mesial to the decidus second maxillary molar. Invariably, this guides the permanent molar into the class 1 relationship. However, a few can proceed into half cusp class 3 during molar transition and further into full class 3 relationship. Continued mandibular growth seen in 14%. Distal step terminal plane. So, the distal surface of the decidus second mandibular molar is more distal to the decidus second maxillary molar. This relationship is unfavorable as it guides the permanent molar into distal occlusion, seen in 10%. There are anterior teeth relationship, canine teeth relationship, and molar relationship. So we already seen molar relationship, which is terminal planes. Now coming to the anterior teeth relationship, so it include overbite, edge to edge bite, and overjet. So overbite, it is the distance which the incisal edge of the maxillary incisors overlap vertically past the incisal edge of the mandibular incisor. So primary incisors erupt in the deep overbite, which is corrected by eruption of the posterior teeth around 5 years of age. The average overbite in the primary dentition is 2 mm. Edge to edge bite, when the incisal edge of the two incisors are in the same plane. This is also called zero overbite, and this is most common due to the atresion, lengthening of ramus, and downward and forward growth of mandible. Overjet, it is the horizontal distance between the lingual aspect of the maxillary incisor and the labial aspect of the mandibular incisor. When the teeth are in the centric occlusion, the average in the primary dentition is 1 to 2 m. Coming to the canine relationship, the relationship of the maxillary and mandibular decidus canines is one of the most stable in primary dentition. So the canine relationship is more preferable than molar relationship. So class 1, the mandibular canine integrates in the embrasures between the maxillary lateral incisor and the canine. Class 2, the mandibular canine integrates distal embrasures between the maxillary lateral incisor and the canine. And class 3, the mandibular canine integrates in the any other relationship. Coming to the arch dimensions, so these were first measured by Zygmundi in 1890, and Frank and Bohm later described the changes which can take place in the arch dimensions by loss of primary teeth and during the development of occlusion. So arch size, this is generally refers to overall dimension of the dental arch, including width, length, and circumference. So first is arch length. So arch length measured from the most labial surface of the primary central incisor to the canine and to the second molar. Arch circumference, it is determined by measuring the length of curved line passing over the incisal edges and buccal cusp of the teeth from the distal surface of the primary second molar around the arch and the distal surface of second primary molar on the other side. Arch width, bicanine or bimolar width is called the archway. In next part, we will discuss development of occlusion in mixed dentition and permanent dentition. Till then, these are the references. If you want these as a PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll share you the PDF. New videos on Sunday. We also put nowadays image-based MCQ in pediatric dentistry in our shorts, and we'll put lots of other types of MCQs related to pediatric dentistry. So press the bell icon for every updates. Like, share, and subscribe. Thank you.